do you work physically with people and find yourself reaching your limits because you can't help them, even though you want to? Then stay tuned, because we're about to introduce you to a completely new method of body therapy that will truly allow you to help people to really release their blockages and enable them to heal and regenerate. It's called the Schneider method. Stay with us now, because we're going to introduce you to this innovative method. Dear Gerhard Schneider, I am very pleased that we can now have this conversation about this completely new and special method of bodywork. Over the course of your life, you've experienced many body therapies and trainings, and then you developed this method yourself, the Schneider method. Could you briefly describe in bullet points how it works?
The core of the Schneider method is what I call three-dimensional modulation. I always work in depth, but at the same time across the surface, and I add rotations as well. This is a completely different way to release adhesions or to work on joints or even organs, because the body is always round. Everything is round, everything flows, and if I approach it in 2D, I can never achieve the same results as with the 3D method.
So 3D, depth, surface, rotation.
And in my method, there are no specific grips, no prescribed techniques, there is only the principle. Grips wouldn't help at all, because everything happens so quickly. The changes happen so fast that you can't even, that would only get in the way. The problem with grips is also that you start looking to see, am I doing it right? Am I doing it wrong? With my method, you look inside. I've also developed the ability to see with my hands. See with your hands? I feel as if I'm reaching into the body because I can't see anything from the outside anyway. Maybe I see a little change in the skin and then that's it. But if I can see inside, then I can feel everything, and everything happens too quickly.
And I also noticed when you treated me earlier for the viewers, Gerhard treated my finger earlier, and now it's wonderfully straight. So the adhesions were released, and I noticed that you really go by feel. That means this Schneider method works not only, but mainly with the therapist's sense of touch or the person who is treating you. The feeling is the crucial part, right? Not the techniques. Could you explain that in more detail?
For me, the most important thing is the knowledge, the understanding of anatomy and physiology. My understanding of physiology is a bit different from what you learn in school, because I understand it in a different way. Then it's really the feeling that's very important, and partly intuition as well. It's a collection of several elements that together really make it work.
And could you still describe it in more detail? So these fasciae, how are they released, or what exactly do you do when you treat someone?
Nowadays, everyone talks a lot about fasciae, but of course it's also all the muscle tissue and even the skin. Everything that's soft tissue is usually stuck together. It's all kind of glued together. You have to understand, when blood or meridian fluid leaks out of its original pathways, it always turns into an adhesive. That's important at first so that healing can happen, but afterwards it becomes an obstacle, and that's what I have to release. Then the layers are stuck together, everything is stuck together. A few days ago, I treated a finger that was terribly injured, capsule tear, ligament tear surgery, and so on. And the woman had undergone countless physiotherapy sessions and other treatments, but in the end, it almost stayed the same. And then in about 20 minutes, I simply released all the adhesions for her. The capsule also closed up again. I noticed that immediately. And then after 20 minutes, she said, now I don't feel anything anymore. Exactly, those layer adhesions. When you use massage techniques or manual therapy, you don't really get into those layer adhesions, and they are so important. I go deep specifically so that I reach every layer at depth, the first, second, third, just going deeper and deeper until I'm through.
So where exactly are these adhesions? Right? Can you explain that?
Yes, if you imagine it, tissue is structured like stacks of bricks or stacks of balls, or also in the spaces in between. When blood leaks out, when serum leaks out, these spaces and these cells stick together. They're supposed to be connected, but not glued together. In a healthy symbiosis, they're connected by fibers, but not stuck together, because then it just doesn't work anymore. Yes, I understand.
Now imagine we have a viewer, maybe a physical therapist or someone else who's watching this and works physically with people. How long does it take until a problem on the client's body is resolved?
Well, you can't really say that in general terms. It just happens incredibly quickly. There are a lot of things where others work for a long time. I'm often done in 10 or 20 minutes, so it goes incredibly fast.
But you have to know how to do it.
That would be the advantage, exactly. Yes, you have to know how to do it. That's interesting too. At the beginning, it's quite a challenge because you're completely focused on this 2D level, and the therapists have to swallow hard for the first day or two. Also with seeing with their hands, when you're used to always working according to guidelines. And the moment that shifts, when this understanding or sensing gets also a bit about feeling once that has switched over, you never go back.
Yes, I believe that.
Once someone has learned that, no one ever goes back.
Yes, exactly. But that's what's important, because how can people actually learn to treat more by feeling? Most people spend hours or even years memorizing books during their training, and we're all very much in our heads, in our thinking. So how can someone learn to treat more by feeling again?
In our seminars, we go straight into these levels. At first, it's almost a bit forced, but you just have to overcome it. But as I said, after 1, 2, or 3 days, many people are already somewhat immersed in it. To really reach that great depth, it often takes a bit more, a lot of practice and a different kind of understanding, because you need to have that understanding. If you only have the conventional medical understanding, you won't be able to handle this. You just can't do it that way. You have to feel and think differently. That's something I immediately address in my seminar.
And probably also turn off your thinking for a while, because you can't feel and think at the same time. Instead, you have to follow the feeling in your hands. And there, you probably pick up on the resonance from the other person's body.
Exactly. It's a form of communication. It's like speaking with the cell, speaking with a person. That's also an interesting suggestion, what you just did. I once read a book by Aplicha, I think. And at that time, I realized that I first need the consent of the person, of the whole person.
Exactly, Annie.
But I also need the consent of the cells. That means I always take a moment to tune in first until the cell knows, okay, this person means well with me, and only then does it open up the possibility.
Exactly.
And Aplicha wrote the same thing. That also led to a big leap forward.
Because let me tell you, I know that when I'm getting a massage, it's hard for me to let go and relax.
Yes.
I first need to build a foundation on an emotional level before I can really let go and allow myself to fall into someone's hands. And that's the crucial thing, that this is probably also when the adhesions are released.
I also work with movement in addition. So people aren't just lying there. They rolled a bit, moved the joints, because we mustn't forget water when it stands still becomes hard. You notice that when you fall on it quickly, that hurts. Water that is in motion doesn't hurt. It's not hard.
Is that so?
We're actually more than 70% water. We basically tubes filled with water, if you want to break it down to a simple level. As soon as it's in motion, all the fluids in me are moving. On the one hand, I can sense much, much faster what doesn't fit, because the movement causes things to open up. I don't have to search forever inside such a hard mess. Instead, it really reveals itself, and the treatment becomes much, much easier. It's almost like a game.
And if, for example, someone has problems with their jaw problems, what could that be related to? And how can someone apply your method?
I need to explain the method a bit further first. So everything that is soft tissue can be treated with this method, from tension, hardening, scars on the forehead, even scars that you can't see.
Aha.
That often gets forgotten, the tonsil scars. Often they're internal injuries, but you can also see them on the outside.
Surgeries.
Abdominal surgery is a really big topic. You can treat the abdomen very well, but also, for example, I had scars that you couldn't see because it was just a blunt impact. The injury was internal, but the skin on the outside wasn't torn. So it's often not recognized as a scar. That can be treated extremely well. It really works super quickly and super well. I also combine that with APM, which is acupuncture massage. I learned it from Benzel, but then I simplified it for myself because there were some complicated parts that you just don't need. So I transformed it into a really quick and simple method. It works fantastically. But to get to the jaw, we have to go to the level that has more or less remained hidden until now, the bone.
Exactly.
The bone is so important, it's unbelievable. And from modulation, osteomodulation was developed because only with this three-dimensional approach can I actually reach the bone. You can't get there with a massage technique. I can cause pain there, but I can't release anything. I've met people who said, yeah, he did the same thing, the masseur, or he hurt me like that too. Because there are situations where you have to cause pain. Very often you don't have to, less than you might think. And then I asked, well, did it help? It didn't change anything. So why cause pain then? I come from a massage background. I know this game. With the 3-dimensional method, I was able to release it. When it comes to the jaw, if you work on the jaw, that's a huge area. So with the Schneider method on the jaw, you have the most amazing experiences.
Yes, and with the jaw, it's related to chewing. It can have to do with the teeth. But how does your method actually work on the jaw, for example?
I can't really say that in general. I always have to look at what the underlying cause is. What I usually see is that the muscles are just softened so that they're back in place. Then it's briefly adjusted, set, or just put back into position. But there are so many buts involved. For example, if you consider a jaw that's properly aligned, it can be completely soft, really soft, like a tightly pressed cardboard box. It's not any harder. You rarely meet people who have that, but I have experienced it. It draws its strength from the alignment, which allows the bone to remain soft and keeps the entire circulation functioning well. If even a single tooth is missing, then the other two have to hold on with all their might to prevent everything from collapsing. That means all the surrounding tissues, the bone, all the filaments, all the soft tissues, the gums, everything becomes completely hardened.
That makes perfect sense.
Then it often tilts inward because the shape no longer fits and the teeth can no longer support and hold each other. That's often the reason why the jaw joints get damaged, why they become loose, or why they keep popping out when you bite. That means when I work on this, I have to make sure that the jaw is completely within this nice curve. That's one thing. Then very often, even when the jaws are too small, which is common nowadays, jaws that are too narrow, we have relatively good tooth growth, but we don't bite anymore. Who still bites anyway? Exactly, the brave ones do it. There are soft foods now, but back in the day, if you ate a carrot, you would be biting for half an hour because it was so full of minerals. That's not the case anymore. And because of that, it doesn't get properly chewed. You can create that space with your fingers, so you don't have to pull the tooth, or so the row of teeth can stand relaxed. That also has to do with it when it's too tight. First it gets hard, then suddenly the jaws start to twist and bend because the curve is longer than the straight part. Interesting. Exactly. And then people say it can't go on, the tooth has to be pulled because it leads to inflammation, pain, and so on. But if you free up this row and you can make it bigger, I often say forge it. In a way, it feels like forging. And you can really do it perfectly so that it becomes nicely rounded, the size is right, and then you don't need to pull any more teeth. Because pulling teeth isn't just about pulling teeth. It doesn't get any better than that. Teeth are connected to organs, teeth are connected to emotions, and so on and so forth. So you simply don't need that anymore.
So once again, it's important, please explain, so we really understand, please explain exactly how effective this is. That means you dissolve the adhesions and thereby also affect the bone, right?
That's one part. Yes, that's correct. I dissolve adhesions. That allows me to release things better, but sometimes I also have to change the shape. The shape? Yes, the shape, it's basically altered, for example, by a missing tooth or by not having enough space. I just said when it's too tight, it bends so that it's still long enough because a curve is longer than a straight line, and then I have to work it back so that it returns to this straight form.
But does the shape stay permanently, or do you have to keep getting it treated, or does it stay like that permanently?
No, it's actually the same thing. When I put in braces, I'm simply inserting a mechanical framework. Is it a bit forceful too? It is forceful as well, slow force, it happens over time. But I have to go a bit further with that. Sometimes I have to release the jaw, sometimes I have to release the head, sometimes I have to release the neck at the back. And not just on the outside. A lot of heads are also jammed up on the inside. So I often have people where I notice I can feel it. That's what you mentioned, this good feeling. Without it, it doesn't work. You find that interesting, and then I feel it, and then I basically move the head and I know how I have to move it. Suddenly there's a crack, and then the tension inside is gone.